Welcome back. In this video we'll talk about multiple myeloma and we'll compare it to the similar diseases Waldenstrom syndrome and MGUS. Multiple myeloma is a result of hyperactivity of plasma cells, which actually reside within the bone marrow, not in the plasma. These cells overproduce immunoglobulins, specifically immunoglobulin G and immunoglobulin A. These immunoglobulins are essentially antibodies, but they are non-functional, so this makes the patient susceptible to infections. Most of these non-functional antibodies break very easily, and they deposit in the kidneys, which presents as Bence-Jones proteins. They also attach to RBCs, giving us the rouleau formation. And because the plasma cells are within the bone marrow, they will eventually replace the bone marrow, causing anemia, which will be normocytic normochromic, and causing lytic bone lesions. If we take a sample of an affected bone marrow, we'll see a fried eggs shape, which is basically these cancer cells filled with immunoglobulins. For some reason, the person who named them thought that they look like fried eggs, and now we're stuck with that. If there is suspicion of multiple myeloma, likely due to the presence of hypercalcemia, bone pain, and anemia, electrophoresis can be confirmative. The treatment is chemotherapy with either lenalidomide or bortezomib. Waldenstrom syndrome and MGUS are very similar to multiple myeloma. So let's compare the striking features so we can differentiate between them. Both multiple myeloma and MGUS have high levels of immunoglobulin G and immunoglobulin A, while Waldenstrom syndrome has high levels of immunoglobulin M. So if the exam mentions high levels of immunoglobulin M, it has to be Waldenstrom syndrome. But if it shows immunoglobulin A, for example, we'll have to look at the symptoms. Like we said, multiple myeloma causes bone pain, hypercalcemia, renal failure, and anemia, while MGUS is completely asymptomatic and most likely accidentally found. Waldenstrom syndrome, on the other hand, presents with hyperviscosity symptoms, so look for blurred vision, vertigo, neuropathy, etc. The treatment for multiple myeloma, like we said, is chemotherapy, while the treatment for Waldenstrom syndrome is plasmapheresis to wash out the immunoglobulin M's, which cause the hyperviscosity. MGUS doesn't need any treatment. And here's a small quiz. Alright guys, that's all I have. Thank you so much for watching and hopefully this helps.